There are some things that apply in every emergency situation. Number one is going to be scene safety. Make sure that, everything is clear, nothing's going to harm you, because you can't help save someone if you can't save yourself. So another thing is going to be how to check the victim. So are they breathing? Do we have adequate chest rise and fall? Is the patient bleeding? Any bleeds that you're able to see? When to call 911 in an emergency situation. It's better to call 911 than not to call 911. Like I said, we said how to check for breathing and how to triage a patient in an emergency situation. If you have multiple victims, if you just have one victim, the scenarios are going to vary throughout.
So if you're on a scene with multiple victims, multiple patients, we typically will treat the most critical patients first and then work our way down to the least critical patients. Most critical means they have very severe bleeding, or they're having trouble breathing, or they don't have a pulse. Always keep in mind that if you're on an emergency scene, there are probably things going on around you. So scene safety is always important, and you need to keep an eye on the other patients if you're treating one.